guys, welcome back to my channel. It's your girl Nadine, and if you are new here and you don't know who I am, my name is Nadine. I am a registered midwife here working in the UK, and if you are a returning subscriber tuning in once again, hello, hi, welcome back to a brand new video, and thank you guys for tuning in once again. So in this video I decided to list a few jobs that you can do within the healthcare sector or the healthcare field that don't require a degree. I'll be listing the job, including the role, the entry requirements and the pay. So if you're interested, stay tuned and let's get into this video. So let's start with the first job. So the first job is a healthcare assistant. I've been a healthcare assistant for many years before I became a midwife, just to gain some experience and just to see how things work. So a healthcare assistant can work in all kinds of environments within the healthcare field. They can work in a hospital, they can work in a GP practice, they can work in clinics, they can work in care homes, they can work in people's homes and in residential homes. So healthcare assistants have a wide range of areas that they can work in. So within a hospital there are numerous duties that a healthcare assistant will undertake while they are working within the hospital. So some of the duties that a healthcare assistant could do in a hospital setting would be checking patients' observations, so the basic observations such as temperature, pulse, saturation, reps, and documenting all of these on the documentation, and also letting the midwife or nurse or doctor know of the findings. Healthcare assistants also make beds, prepare food or help serve food, help with feeding the patients who find it difficult to feed themselves, changing patients, assisting with personal care of the patients, helping patients move around the hospital, talking to patients, making patients feel comfortable, just being with the patient. So basically within the hospital, healthcare assistants work alongside nurses, midwives, doctors, all other healthcare professionals, and they basically assist them in all the duties that need to be carried out. So if a patient needs to be changed and the nurse needs some assistance, the healthcare assistant will help with changing a patient, making a bed, helping with feeding, doing basic observation, helping with take blood, move things around from ward to ward, just little things like that. So within the hospital, those are the basic duties that a healthcare assistant would do. So the basic entry requirements, or what you need in order for you to become a healthcare assistant, is there is no set entry requirement for a healthcare assistant. I started as a healthcare assistant when I was in college. So college, I had my basic GCSEs, I had my maths and English GCSE, and I just basically applied and I was able to get the job with just GCSEs and nothing else. No other experience, no other training, just my basic GCSEs. Normally they require you to have maths and English GCSEs, but some companies do not require that, as I've been working with a few people that do not have maths and English GCSE and they are still healthcare assistants. So there is no set entry requirement to be a healthcare assistant, but some companies, some organizations do require the basic minimum of maths and English GCSEs, and some don't require that at all. Some may take you with zero experience because you kind of just learn and pick things up on the job, and they train you as well. And some may ask, have you worked in this field before? For example, majority of the jobs that healthcare assistants apply for in a hospital, they tend to go for people with more experience. However, there are hospital-based jobs for healthcare assistants that don't require you to have any experience, and they kind of train you and teach you as you go. So as a healthcare assistant, there is no set entry requirement to actually do the job. Most of the organizations or the company will train you, and they will just teach you as you go on your journey as a healthcare assistant within that company. So as a healthcare assistant, the pay is basically varied. depending on the organization where you work, whether it's in a hospital, care home, people's homes, it's very, very varied. But the average of how much a healthcare assistant could earn is between 18,000 and between 24,000 a year. So that is the average salary of a healthcare assistant working within the UK, in those various different environments or departments. But each department pays differently depending whether you're in a care home, a private organization, hospital, or people's homes. So that is just the generic and the average pay for a healthcare worker. So that is 18 to 24k a year. So the next job that doesn't require you to have a degree, which I know very, very well, is a maternity support worker or maternity assistant. So maternity assistant work alongside midwives, they work alongside doctors, and sometimes alongside nurses. So maternity healthcare assistant or the maternity support workers work in the hospital, they work in the clinics. So what they do in the hospital, they could work on labor ward, they can work on postnatal ward, they can work on antenatal ward, they can work in the community, and they can work in, you know, clinics. So wherever a midwife would work, a maternity support worker could also work. And the duties of a maternity support worker would be supporting the midwives. So they'll be supporting the midwives with breastfeeding, so offering breastfeeding support to the mums who are struggling with breastfeeding. They could support the midwives with doing documentation, doing observations on mums, so doing the basic blood pressure, pulse, temperature, reps, stats. They could do all of those. They could help with meal times, preparing meals or serving meals to all the patients or women's on the ward. So things like that. They could also assist midwives in taking blood if they have been trained in taking blood, so they can do that also. So maternity support workers could also work in theatre, assisting with C-sections. So what they will do in theatre is basically assist when a cesarean section is happening. So they'll be assisting with all the equipment, making sure all the equipment is fully stocked, making sure if, you know, they need something during the surgery, they can go and get it, things like that. Or preparing a mum before she goes into the theatre to have her section, or things like that. A maternity support worker could also be assisting with preparing the rooms, making beds, you know, obtaining orders, collecting orders. So there's a lot of things that a maternity support worker can do within the hospital or within the midwifery world, working alongside midwives, doctors and nurses. So the entry requirement for a maternity support worker is similar to the healthcare assistant that I described previously. So some employers may ask for basic maths, English, GCSE and nothing else, and some employers will not, you know, require that because some may not have it. Or they might ask for an equivalent to your maths and English GCSE. So that is basically the entry requirement. Some may ask for maths and English and some may not. Some may train you on the job and some may ask for training depending on where you are applying, but majority of them take maternity care assistants on and then they train them before they start. I've seen a lot of students who are maternity healthcare assistant. They literally, you know, were trained on the job, they applied and then they were trained and then they started working as a maternity support worker. So there's not a lot that you need in order to become a maternity support worker, but some employers may ask for maths and English, and if you don't have maybe an equivalent to your maths and English, and some may not ask for that at all. So the average pay for a maternity support worker is also similar to a healthcare assistant. So the average is 18 to 24k a year, and this also depends on where you work and how many days you work. The average pay is 18 to 24k a year. So the next job on the list is a ward clerk or a medical secretary. So a medical secretary basically is the frontline staff that you see when you walk into the hospital or the GP practice or the clinics or the surgeries. So they are the first point of call when you come into the hospital, onto the wards, into the clinics. So they basically make sure that all patients have all the relevant information that they need for their care. So if they have appointments, if they need appointment letters, if they need to be checked in, checked out, if they need to be assigned to the right doctor, if they need to be in the right place, if they're asking for certain information about their appointments, their care, they will go to the ward clerk or the secretary. Also, the ward clerks help and assist all the other healthcare professionals working within that area. So the doctors, the nurses, the midwives, the anaesthetists, all the other healthcare professionals that need assistance with, you know, patients' records, finding records, making appointments, booking appointments, checking patients in. They basically assist all the other healthcare professionals in, you know, making sure the patients are filed in properly, booked in properly, they have their appointments, chasing blood work, chasing blood reports, and all of that. So that's basically an overview of what the duties of a ward clerk and a secretary does within the healthcare industry. So in order to become a ward clerk, there are no set entry requirements. This goes with the other two that I've mentioned previously. There's no set entry requirements to become a ward clerk. You can literally just apply as you are. Some employers may ask for your basic maths and English or an equivalent to your maths and English, and then they'll train you before you start. So becoming a ward clerk or a medical secretary, there are no basic entry requirements. You don't have to have a degree, you don't have to have you know, a certificate in a certain training. They will basically train you on what you have to do, and they basically may ask for the basic maths and English or an equivalent to your basic maths and English, or some employers may not ask you for either. So it just depends on where you go and apply, but there are no set entry requirements to become a ward clerk. But in saying that, most of the employers put a disclaimer in their advertising of the job. They are looking for someone that has good IT skills, good literacy skills, because there's a lot of computer work, there's a lot of filing, there's a lot of reading. So if you have your basic IT skills, your basic literacy skills, you will do just fine. So those are the basic things that they look for. So basic English and maths GCSE or an equivalent. So your IT skills, if you have good IT skills, and then they'll train you with everything else that you need to do for that role. So the pay for a medical secretary or ward clerk is between 17 to 24k a year. So this is just an average, so depending if you work in the hospital, in the clinic, this will change or it will be a little different. So this is the average pay. It will be between 17 to 24k a year. So the next job on the list is a phlebotomist. So a phlebotomist take blood samples from patients that then get sent to the laboratory to be examined for diagnosis of an illness. So they are instrumental in actually diagnosing patients and actually getting a results from the patients and actually analyzing their blood work. So basically the job for a phlebotomist is very basic, very simple. All they need to do is take blood samples from patient, make sure that they're taken safely, accurately, they are stored correctly, they are labeled correctly, and that they are sent correctly to the lab. Phlebotomists can work within the hospital, within clinics, within the GP surgery. There's a wide range of areas that a phlebotomist can work, and you do not need a degree in order to become a phlebotomist. So the entry requirements or the things you need in order to become a phlebotomist is, you know, some employers usually ask for the basic maths and English GCSE or an equivalent to that. Obviously there are some employers that do not, you know, request this, but usually most of them just need your basic maths and English or an equivalent to this, or a BTEC that you've done, or an access course that you've done, or healthcare course that you've done. You do not need a degree to become a phlebotomist. If you have your basic maths and English or something equivalent to this, they will just take you on and they will train you how to take blood. Some employers usually take on people without experience and they get taught how to take blood, and some employers like to take on people that already know how to take blood or they are already experienced in taking blood, but this is subject to the employer and what they want. So the average salary for a phlebotomist is just the same as the previous ones I've discussed. It's between 18 to 24k. So the higher you go on this paying scale, I don't think I've explained this before, will depend on your experience and how long you've been working as a phlebotomist. So the more experienced you are, the higher the pay you get, but the average is 18 to 24k a year. So the next job is a pharmacy assistant. So a pharmacy assistant basically assists the pharmacist or the pharmacy technician in ordering, preparing and dispensing medication within the pharmacy that they are working in. So as a pharmacy assistant, you are working within the pharmacy, working alongside the pharmacist and the pharmacy technician. So you will be assisting them in ordering medication, in preparing medication and in dispensing medication. So as a pharmacy assistant, you will be started on a band 2 and 3 pay scale within the NHS. So we go by band depending on the experience and the qualification you have. So as a pharmacy assistant, you will be on a band 2/3 paying scale. And if you don't know what bands are, I have a previous video that I've recorded. I'll link it in the description box below or on this video somewhere up here, so you guys could have a look at that, where I go into some detail about bands and what they are. So a pharmacy assistant will be at a band 2 and 3. So the basic entry requirements for a pharmacy assistant is just like the previous ones that I've discussed. You don't need any major qualification. You don't need to be a pharmacist. You don't need a degree in pharmacy. Some employers are looking for your basic maths and English and IT skills or something equivalent to that in order for you to actually apply and become a pharmacy assistant. So you don't need to have a pharmacy degree. All you need to have is your basic maths and English or something equivalent to that and good IT or literacy skills. So the average pay for a pharmacy assistant is 16 to 21k a year. So obviously this varies whether you are private or you are in a public sector, but the average pay is between 16 to 21k. And like I said before, depending on how experienced you are or how long you've been working as a pharmacy assistant will depend on how much you get paid. So the more experienced you are and the longer you've been working as a pharmacy assistant, the more you will get paid and the more you will go up a band depending on the training and the experience. So the next job is emergency call handlers. So they deal with emergency calls from the public and they make sure that the right help reaches each person that makes a call to the emergency department. So emergency call handlers need to be able to work quickly and calmly and gain enough information from the patient that is calling, including their condition, their location and the service that they require. So they basically deal with the public who are making an emergency call, and they take down all the information that they are told and then they pass it on to the correct person. So if that person needs a doctor, a nurse, an ambulance, whatever they need, the emergency handler will then allocate or then share this information with the right person or the right team and ensure that help goes out to that person. So they need to be very calm when they are receiving calls. They need to react quickly but calmly. They need to also be able to listen and take in as much information as they can, including the condition the patient is calling about and the location, in order for someone to be sent out to them and reach them in good enough enough time and to come with the right, you know, equipment, or the right person is sent out to them. That's basically what an emergency call handler does. So they just receive emergency calls from the public and they respond to them. They make sure that the right help reaches that person. Also, as an emergency call handler, you could also work as part of the NHS 111 service, which is a non-emergency number. You could also be working within that field. So if a patient calls about something that's not urgent, something that's not life-threatening, and they just basically call you on the 111 service, you are able then to assist them to a, you know, a doctor or a nurse that can come and see them when it's not an emergency, when they don't need to send out like an ambulance to them. So just like the other jobs that I discussed in this video, there are no set entry requirements for this job. Some employers may look or may ask for your basic maths, English, GCSE or an equivalent of. They may also look for good IT or literacy skills, because obviously you are working on a computer, answering the phones, you're writing things down, you're passing on information. So they may ask for good IT or literacy skills, and they may ask for your basic maths and English GCSE or something equivalent to this. But there are no set or basic entry requirements for this role. You do not need a degree or extra training. Some of these employers will just basically take you on and train you and show you how to do your job. So, you know, you don't need a degree in how to handle emergencies. You don't need to be a paramedic. You don't need to be a doctor. You just basically need, you know, some employers will basically ask for your basic maths and English, and some may not. But that is basically the overview of the entry requirements. There are no set entry requirements for this job, and you do not need a degree for this job. So the average pay for this job is between 20 to 24k a year. So depending on how long you've been working as an emergency call dispatcher or call handler will depend on how much you get paid. But the starting is 20 and the highest is 24. So that is basically your average pay for this role. So the next job is an ambulance care assistant and a patient transport service driver. So basically these people help transport the vulnerable, the sick, the elderly and the disabled people to and from their appointments, or if they're coming into hospital for something, or if they're having to leave the care home for an appointment, or they're having to, you know, be escorted to and from a certain area. They basically assist in driving the most vulnerable patients, so the elderly, the sick, the disabled patients, either to and from their appointments, their homes, to clinics, to the hospital, from the care home and so forth. So they will be in charge in going to the, you know, person's home at the certain time, picking them up, taking them to the appointment or location where they need to be, and then taking them back home. So these people are basically responsible of looking after the patients that they are, you know, transporting from place to place. They need to be able to get them to that place safely, making sure that they are well looked after, they are safe, and making sure that they have basic life support training. But obviously this basic life support training is given to you by your employer. You don't need to have this before you apply for the job. They teach you this probably yearly to make sure that you are constantly up to date. So the entry requirements for this job is the same as the others. There are no set entry requirements required for this job. Some employers may ask for your basic maths and English or an equivalent to this at GCSE level, and some may not, and everything else you will be taught once you get the job. So it's not a thing where you need to have, you know, experience in looking after these certain vulnerable patients or people, but you will be taught how to care for them, how to safely transport them, what you need to do, what you don't need to do. But some employers may ask for your basic maths and English, and some may not. Obviously, you will need to be able to drive, so if you have a license, that is a very big plus. Those that don't have a license, it wouldn't make sense for you to apply for this role because you will be driving people around. I guess the entry requirement is to have a full license to be able to transport these people from A to B safely. So the average pay for this role is 18 to 21k a year. So depending on how long you've been working and how experienced you are, the more you will get paid. But the average is 18 to 21k a year. So the next job is a radiography assistant. So let me just quickly read a quick description of what you will be doing and how a radiography assistant will help the radiographers in what they do in their day-to-day life. So this is just a brief explanation of what they do. So as a radiography assistant or imaging support worker, you'll work closely with diagnostic radiographers who are using imaging to work out which disease or condition is causing a patient's illness, and or therapeutic radiographers who use doses of x-rays or other ionizing radiation to treat medical conditions such as cancer or tumors. So that's basically a brief summary of what the job entails and what you'll be doing while working with the radiographers. So as a radiographer assistant, some of your duties and responsibilities will include processing images, helping with procedures such as biopsies, making sure that the work environment is clean and hygienic, preparing patients for treatment, including lifting patients, checking the equipment and reporting faults, inputting data into the system. So that's basically some of your responsibilities as a radiography assistant, and you'll be working basically in a clinical area, whether it's in a hospital, somewhere private, or in a clinical setting. But those are basically your duties. You will be assisting the radiographers and you will be making sure that the environment is safe, patients are safe, making sure you are inputting the correct data and just things like that. So the entry requirements for this job, there are no set entry requirements for this job. Some employers may ask for your basic GCSE maths and English or something equivalent to this. They also may ask for you to have good IT and literacy skills, but there are no set qualification that you need for this job. You don't need a degree, you don't need a certain qualification. You just need to either turn up with your basic maths and English, good IT skills, and just go for the interview. And some employers may not ask for your basic maths and English or something equivalent to this. So it all depends on where you apply, but there are no set qualification that you need in order to do this job. So the average pay for a radiography assistant is 18 to 24k a year. So that's basically the average that a radiography assistant gets paid. The more experience that you gain, the higher you go up in the paying scale, but that is basically the average, 18 to 24k a year. So the next job on the list is a physiotherapy assistant. So a physiotherapy assistant make a difference to the lives of the people that they care for. So they help them recover from illnesses and condition. And also a physiotherapy assistant is a great route if you want to become a physiotherapist in the future and actually go and study and actually do the degree. So basically that's what they do. They help people recover from illnesses and conditions that they currently have, and you are basically there to help them through this and give the physiotherapist some support and some assistance while they help these people make a difference in their lives. So I'm just going to list a few of the responsibilities / duties that a physiotherapy assistant will be doing while working. So things like setting up equipment, showing patients how to use mobility aids, helping patients prepare for treatment, including helping them get dressed and undressed, working on exercises with patients, writing reports and updating patients' records. So that's basically what you are required to do, or your responsibilities are as a physiotherapy assistant. So I'm now going to list a few of the departments a physiotherapy assistant can work in within this field. So you could work in the outpatient department, the women's health, elderly care, stroke services, mental health and learning disability services, occupational health and pediatric. So there's probably loads of other areas that you can work in as a physiotherapy assistant, but those are the basic and generic ones that I have listed here. So the entry requirements for a physiotherapy assistant: there are no basic entry requirements for physiotherapy assistant. You may need your basic English and maths, but some employers will not look for that, but some may ask for your basic English, maths, GCSE or something equivalent to this, and they may also ask for good literacy skills or good IT skills. Every employer is different. Just look into each job description and each requirement before you apply. But this job, you do not need to be a physiotherapist beforehand. You do not need a degree, you do not need a certain qualification, but you may be asked for your basic maths, English, GCSE, or some IT skills or literacy skills. So the average pay for a physiotherapy assistant is between 18 to 21k a year. This varies depending on the experience and how long you've been working as a physiotherapy assistant, but the average pay is 18 to 21k a year. So the last and final job that I have is an occupational therapy support worker. So basically what an OT support worker does is they work to support people who are struggling with day-to-day activities to live a full and independent life. So you are basically supporting these people just go about their day, making sure that they live a full and independent life. What they may be struggling with with day-to-day activities, you are there to support them and make sure that they have the right things in order for them to live a full and fulfilled and independent life. So you will be working with people with illnesses or disabilities, or the elderly who struggle with day-to-day activities and they need that extra support, or they need things put in place in order for them to live a fulfilled and independent life. So that's basically what you will be in charge of and what you will be dealing with. So some of your responsibilities as an OT support worker would be washing, dressing and helping people with eating, working with them and educating them in how they can do things better to help them complete their day-to-day activities, or how they can live a more independent life. So it's more like educational and actual helping them in their personal lives, putting things in place for them, referring them to specialists if they need extra support. You'll be working alongside other healthcare professionals that may need to be seen by these people, and there's things that actually need to be put in place. So that's basically what you will be doing as an OT support worker. So the entry requirement for an OT support worker is the same as the others. There are no set entry requirements for this role. Some employers may look for basic maths and English qualification at GCSE level or an equivalent to this, but others may not. But there are no set entry requirements for this. You don't need a degree, you don't need extra training, you don't need a certificate. There are no set entry requirements. Each post is different, so make sure you look into it and see what they are asking for. But some may ask for basic maths and English at GCSE level and some may not. So the average pay for an OT support worker is 20 to 24k 24k a year. So that is basically the average. It depends on where you work, how long you've worked, if you're public or private. So all that needs to be considered, and it will demonstrate in your pay. But the average is 20 to 24k a year. So I can see that my battery is flashing red, so my camera is about to die any second now. So I'm gonna go ahead and end this video right here. Thank you guys for watching. If you guys found this video helpful, please give this video a thumbs up and make sure you hit that subscribe button if you're not subscribed already, and I'll see you guys in my next video. Bye.